All right, I think we have a good number on, and it's 102, so we'll go ahead and get started. I know more people are probably joining. But again, this is Jo Twombly, and I'm with the Alliance for Natural Health USA. I want to thank you for joining us for today's congressional briefing on natural health during the COVID-19 pandemic. We're going to record today's webinar, and it will be available on our Alliance for Natural Health website for those who are unable to attend today. And we should also have time for questions at the end of today's presentation. And you can type your questions into the question box at any time during today's briefing. So as our nation deals with the COVID-19 public health crisis, the free flow of information about potentially beneficial prevention and treatment options is critical. However, many Americans are unaware of the ways in which our healthcare system actually blocks access to this information. During today's briefing, we will discuss the problem with our current healthcare system, how it is blocking access to this information, and we will also hear from Dr. David Brownstein to share information about natural health options that can help with COVID-19. And it may surprise you to learn that the FTC actually sent a warning letter to stop Dr. Brownstein from sharing this information. And lastly, we're going to provide a recommended solution to stop this government censorship and help Americans get the information they need for their health. So before we begin today's presentation, I would like to briefly introduce our organization and today's featured speaker, Dr. Brownstein. So as I mentioned, I'm Jo Twombly, Deputy Director for the Alliance for Natural Health USA, and we are a consumer advocacy organization with 1 million members across the United States. We work to protect the right of natural health practitioners to practice and the right of consumers to choose the healthcare options and treatment modalities they prefer, including complementary and alternative medicine. We believe that a system that is single-mindedly focused on treating sick people with expensive drugs rather than maintaining healthy people is neither practical nor economically sustainable. And we're also glad to have our expert presenter here today, Dr. Brownstein. Dr. David Brownstein has practiced holistic medicine for more than 28 years, and he is well respected by prominent health organizations. He's a member of the International College of Integrative Medicine and is on the board of directors. And he's also active in numerous holistic organizations and has lectured internationally about his success using natural therapies. He's the author of 16 books covering issues from including leaky gut, the need for iodine, thyroid disorders, arthritis, and natural therapies. And he also has a new book coming out in just a couple of weeks titled A Holistic Approach to Viruses. So thank you for joining us today, Dr. Brownstein.
Thank you for having me, Jo.
So the Alliance for Natural Health has been focused on the structural problems of our healthcare system for many years, particularly the problem of cronyism in healthcare. And as we face the COVID-19 pandemic, it has become even more apparent how we are being failed by a medical system that relies on newly patented pharmaceutical drugs to treat sick people, rather than preventing disease with safe and expensive natural medicines. Most people are not aware that natural medicines are not able to be patented in the same way as new to nature synthetic pharmaceutical drugs. But as a result of this, it does not make economic sense, and companies cannot afford to pay the billions of dollars typically required for FDA drug approval. But without FDA drug approval, natural medicines cannot claim to prevent or treat diseases. If they do, the FDA will threaten them with a warning letter saying that they are claiming to be an unapproved drug, or the FTC will issue a warning letter saying that their claim is false advertising. Unfortunately, by not being able to gain FDA drug approval, it means these natural medicines are excluded from mainstream medicines. And doctors are taught to rely on treating unhealthy patients with expensive pharmaceutical drugs, rather than learning about natural, less expensive options that could benefit Americans' health. The free flow of information on natural health options is particularly needed during this pandemic when we don't have pharmaceutical options that work. However, the FTC and the FDA continue to attack those who try to share information about natural medicines that could help prevent and treat COVID-19. So here are just a few examples of natural treatment and prevention claims the FTC and the FDA have banned. The FTC has sent warning letters to several doctors for sharing information about these natural options that could help with COVID-19. And you may recognize that a couple of these options were even used by President Trump when he was dealing with COVID-19. According to media reports, he took vitamin D, zinc, and melatonin to treat the virus. And that's just what we know about from the media reports. So it's possible he might have been using other natural therapies. It certainly begs the question, if these natural therapies have enough evidence and support that the president is using them, then why can't doctors share this information with the public? So the last two examples here, chromium lowers blood sugar levels and magnesium lowers blood pressure levels, are claims that the FDA has banned because it says they are implied disease claims. The FDA says that chromium lowers blood sugar levels is an implied disease claim for the treatment of diabetes. And the FDA says that magnesium lowers blood pressure levels is an implied disease claim for hypertension. Therefore, the FDA would say someone making these claims about a product is making an unapproved drug claim. Now, Dr. Brownstein has firsthand experience dealing with this issue with the FTC's restrictions. So, Dr. Brownstein, could you share your experience with everyone?
Thanks, Joe. I was following COVID from the beginning of the crisis, and I followed the reports right out of China in the end of December. And as it was clear in the middle of February that COVID was going to come across our country, starting in the West Coast and move to the East Coast, I remember having a meeting with my staff at the end of February when everyone was tense. We were warned this could be the greatest catastrophe our country has seen. They were looking at 1 to 2 million deaths, and they were projecting that at the beginning of this crisis. And so my staff was on edge. We had a meeting at the end of the week, and I said to them, "Look, we've been practicing medicine for I've been practicing medicine for over 28 years." I said, the first 28 years were truly practiced for something like this. And this is a disease with no known treatment to it. It was new. There was no known studies on it. And I said to the staff, it's just another coronavirus that's out there. We've treated many patients with coronaviruses over the years, even though we never tested for them, but coronavirus makes up about 20% of flu-like illnesses every year. And over our 28 years of using a natural approach to treating viral infections during flu season, our patients don't get hospitalized, they don't die, and they don't get as sick as anywhere near the national numbers show they should. So I reassured the staff that as best I can tell, I think we'll have this covered. I couldn't guarantee anything, but I was confident we could deal with this. And then coronavirus hit Detroit a couple of weeks later. We were one of the major hotspots along with New York and New Jersey and Massachusetts at the beginning of the crisis. And there was a worry that our hospital beds were going to overflow and people were going to be on the streets and not being able, they wouldn't be able to be given ventilators when they didn't, because they were going to run out of ventilators. So we started hearing patients being sick. They would call us, and we would go out to the parking lot and treat them, as you can see in the pictures below. And I had them all start the oral therapy of vitamins A, C, D, and iodine, and they were nebulizing hydrogen peroxide and iodine. For those who needed more treatment, they would show up outside, and we would come out after work or early in the morning and put IVs in them from their car door. And just as it's happened for the last 28 years, our patients got better. And I in the middle of this, I was blogging at night and trying to give people hope that there was a therapy out there that could work. And I would title the blog post about Corona, "There's Still Hope Out There," because at that time in March and April, the news was horrendous. They were saying there's nothing that can be done. We're gonna see these 1 million to 2 million deaths, and everyone was scared. And we weren't seeing it in our parking lot. We weren't seeing it in our office. So when patients got better, I would interview them over, the internet, and then I would put it on my website, and I would title it, "There's Still Hope Out There, number 1. There's still hope out there, number 2. And we were somewhere in the 20s when, I had received my warning letter from the FTC telling me to cease and desist, that there was no treatment, prevention, or cure for coronavirus. They went through every one of my videos in detail and bullet pointed out what they said was untrue. and they would quote me or the patients, and they would say, well, there's no studies that show that what you say is true, therefore um, this is false in violation of FTC code, and it was a long code, and you have 48 hours to remove this or else. So I remember getting a letter. Well, I came home from work and I had my bags in my hand. I was tired. It was a long day. We did parking lots at the end of the day, and I got my coat on, and I looked at my wife, and she's sitting over the computer with my daughter looking over her shoulder. I looked at their faces and I said, "What's wrong?" And she said, "We got a letter from the FTC. We have to shut everything down." And I said, "A letter from the FTC? You mean the Federal Trade Communication to me?" And she said, "Yes." And my wife's a lawyer. She explains the letter to me. And I said, "That's ridiculous. I'm not advertising. I'm giving the patients their stories and telling people that there's still hope out there." And she said, we should shut everything down and we'll have to figure this out. And my first comment was, well, maybe it's time to retire. And she got an angry look and said, "You're not retiring over this letter. I've read this 3 times. This is nonsense. And we'll get by this. But you want to retire because you don't like medicine anymore. We'll talk about that, but not over this." And so we shut our website down, took everything down. And, I contacted the Alliance for Natural Health. Well, they contacted me, when they saw what happened, and they were very supportive of me and gave me some guidance on what to do. And what I found out in the interim was we're still treating patients. We're still seeing them. I published a study, a peer-reviewed study of 107 patients, got it peer-reviewed, went through 4 rounds of peer review, got it in a journal. And then my wife sent a letter to the FTC and said, "You said there's no studies showing what I say works. Well, here's a study. Here's a peer-reviewed study in a journal. We want to publish this study without commentary on our website." The answer came back, no, it's not a randomized controlled study. So in effect, when they didn't mention that in the first letter, they moved the goalpost back on me. So I have a study out in the public realm I can't talk about on my website. But unfortunately, that's where we sit today. And we have over 200,000 people who died from an illness that, some people are going to die from any illness, but I don't think that many people had to die from this. There are therapies that work. We should be able to talk about them. I'm a licensed, board certified physician. And unfortunately or fortunately, what I found out was I can write a book about it. And that seems to have First Amendment protection. That's why I wrote my book on viruses, which is at the printer right now. But, I still don't have a website that's up right now, and that's kind of where I sit right now.
Yeah, thanks so much for sharing your experience. It truly demonstrates the problems with our government censoring information that could really help Americans, especially during this pandemic. Also a quick housekeeping. Some people are asking, if the slides and the presentation will be available after this presentation, and that they will be. We'll share the recording and the slides. And also you can ask questions in the question box, and we'll get to some questions at the end of this presentation. But so as the Alliance for Natural Health has been focused on this issue for many years now, we've come up with some of the legislative changes that our country needs to help this get better. And there are a few key changes that could really make a difference. The key being that doctors and other medical professionals and supplement and food manufacturers and sellers should be permitted to share peer-reviewed studies and articles that demonstrate the potential health benefits of these natural health options. Specifically, we would like to see the ability to share Medline Index publications. These are publications that have been vetted by the director of the National Library of Medicine, and they're based on their scientific policy and quality. They're chosen based on those. And we don't think the FTC should block access to information by requiring a food or supplement to have randomized human-controlled clinical trials before any possible health benefits are shared. We think it's important for the public to have access to this information about early food and supplement clinical trials that could help benefit Americans' health. And we also think it's important for the FTC to be required to meet the proper burden of proof before they can claim a supplement is false advertising. And lastly, we would like to eliminate the FDA's so-called implied disease claims by mandating that the FDA can't determine that a supplement claim is a disease claim or an implied disease claim unless that claim includes the name of a disease. So to help us achieve these changes, the Alliance for Natural Health has a petition that's going to the President, members of Congress, all of our state governors, and every state legislature, urging them to reform our healthcare system, which not only bars the use, but even the mention of natural remedies that have not been and never can be put through the billion-dollar FDA approval process. And we'd like to ask for your help in achieving this reform. And you can do so by visiting supportnaturalmedicine.com and signing this petition. And that URL is at the bottom of the slide, as you've seen. So now that we've discussed this problem and the needed solution, I would like to encourage you to continue following this issue by subscribing and reading our Alliance for Natural Health e-newsletter, which can keep you updated on this issue and others important for natural health. And before we go to questions on this, Dr. Brownstein, is there anything else you would like to add?
Well, I read my FTC warning letter 5, 6 times, and I read the law, and I do think the law is a good law. It's just being misapplied. And I went to the FTC site and saw the 350 or so letters they sent on this topic, and there were some bad things out there being said, as cures for COVID. I never said a cure for COVID. I said this is how I'm treating my patients who happen to be diagnosed with COVID. And that's what I was taught in medical school, was you report your successes, you report your failures, so other doctors can learn from what works and what doesn't work, and can verify what works and what doesn't work. And for what I thought I was doing a good thing, receive a warning letter from a federal agency that, I'm somewhat proud to say, I told my mother, when I told her about it, that, gee, Mom, I'm so proud to say I'm the first of our family to get a warning letter from a federal agency. And, for doing what I thought was the right thing. But the law is not a bad law. It just needs to be applied correctly.
Absolutely. So now we have a little time to answer questions. Let's see, I have a couple already in. Someone was asking, and I don't know if you know the answer to this offhand, Dr. Brownstein, but they asked, did they use the term standard of care? I don't know if that's...
I can't recall whether they used the term standard of care in the letter, but I believe it was there, or it was implied that it was there.
Okay. Oh, somebody asked.
Think about it with COVID, folks. There is no standard of care. It's a new illness. There is no randomized, controlled, placebo blinded studies because it's a new illness. So asking for something like that in March at the beginning of COVID was asking for a rainbow, to create a rainbow out of thin air. It just it wasn't available, and there was no way anyone could have done it. It was a new illness. None of us knew how to treat it. Why shouldn't we all be reporting what worked and what didn't work with it?
Yeah, absolutely. And someone's asking, is this happening with a number of doctors? And then is there a possibility of an amicus curiae? So yes, it is happening, obviously, with a number of doctors. FTC has sent, I think, hundreds of warning letters at this point. So I'm not certain about the next steps as far as all of those doctors coming together, but that could be a possibility at some point for sure. And then someone asked when the book will be available for sale and what is the title, and I'll let you say that, Dr. Brownstein.
The title is A Holistic Approach to Viruses, and it'll be available in about 2 weeks. It's at the printer. It's in its very final edit in the next day or two, and then should go right to print. And hopefully I'll put it up on my website when this is available. We're working on restructuring that to try and comply with what the FTC wants.
Yep. And then please type this support. Oh, okay. And then someone asked, is it okay to supplement with iodine even if past tests have shown the iodine level is sufficient? What is the best test to determine iodine level? So that's pretty specific, but.
Well, I've tested over 7,000 patients over 20 years between me and my partners, and over 97% of people are deficient in iodine. The vast majority severely deficient in iodine. Iodine levels have fallen across the United States over 50% over the last 40 years, according to the NHANES data from the U.S. government. So sufficiency in iodine is rare in the U.S., and iodine is necessary to maintain the the structure and function of the glands of the body, the breast, ovaries, uterus, prostate, pancreas, and thyroid. Those are all the tissues of the body we're suffering epidemic problems with. 1 in 7 women have breast cancer, 1 in 3 men have prostate cancer. Thyroid cancer is the fastest growing cancer. My premise has been that the reason we're seeing so many problems with these glandular tissues is iodine deficiency, which sets a stage for abnormal growth in these tissues.
Great. Someone asked about the URL for the petition. It's supportnaturalmedicine.com. So if you go into that URL, and we'll send that in the follow-up email as well, but it's supportnaturalmedicine.com to go to that petition. Someone asked, do you share Rudolf Steiner's view that viruses are not the real cause of an illness, but are a synchronicity phenomenon?
Look, humans have been around viruses since the beginning of time. We've learned to live with them. We've learned to survive them. When we're old, we're also going to learn to die, and viruses do kill a lot of older and sicker people. But I think that if we have a good terrain and we have a good diet, and we have a good body, healthy body going into an illness, we can survive this illness. So do I think that viruses should be our enemy? No, they're not our enemy. We've lived with them. A good portion of our body DNA and RNA is made of viruses. And viruses do specific things to our immune system to make us actually stronger as we go. So I think that there's a different way to look at viruses. Conventional medicine is sort of make the diagnosis and treat the one thing, but they don't look at health enough, and how to really support the immune system, which is what I've been doing for the last 28 years.
Mm-hmm. Yeah, another person, it's a specific question. What is the best test for fortidine? And I may not be pronouncing that correctly.
For iodine, is that what he's asking?
Yes, sorry.
So iodine, the best test is a urinary test for iodine. And the single best urinary test is a 24-hour loading test where you take 50 milligrams of iodine and you collect urine for 24 hours and you see how much the body retains and how much it excretes. And then from that number, you can figure out if the body is sufficiently loaded with iodine or not. And I did the original work with that with my mentor in iodine, Dr. Abraham, around 2000 or a little bit earlier than that.
Mm-hmm. And then someone asked, do people with Hashimoto's need to worry about taking too much iodine? I was told with Hashimoto's I have to be careful about my daily iodine intake.
So Hashimoto's disease is an autoimmune problem, an inflammatory problem of the thyroid gland. It has skyrocketed over the last 40 to 50 years. And during that same 40 to 50 year time frame, our iodine levels have declined over 50% across the US. So that's a negative correlation. Declining iodine levels, associated with an increasing in Hashimoto's and Graves' disease, two autoimmune problems of the thyroid gland. That single fact disproves that iodine causes Hashimoto's and Graves' disease. My experience is clear. It's iodine deficiency that sets the stage for autoimmune thyroid disease, and I discuss that in detail in my book on iodine. And it's iodine therapy that helps it.
Yeah. Someone asked who's speaking, and it should be on their screen, but it's Dr. David Brownstein. This is Joe Twombly with the Alliance for Natural Health, and then we also have Dr. David Brownstein. And someone asked, they said they've been trying to find any peer-reviewed controlled studies that asymptomatic people can spread COVID. Do you know of any truth about asymptomatic spreading it?
We still don't know how COVID is spread. We can hypothesize it's spread through respiratory droplets. It hasn't been proven yet. It very well may be spread by, hand fecal contamination and flushing toilets and, getting the vapors from that. We don't really know right now how it's spread. And the mechanism hasn't been elucidated yet.
And someone mentioned kind of a point there, a UK scientist. So I guess, we obviously have some international members of the Alliance for Natural Health, and they're looking for volunteers to take part in a trial on vitamin D to see if it can give an immune system a boost against COVID. So I guess you can reach out to me if you're in the UK and interested in that. But I don't know, Dr. Brownstein, if you would like to speak at all about vitamin D, because I also had an emailed question about vitamin D and COVID and kind of the relationship there.
So I've been checking vitamin D levels in people from the early 1990s. And, I clearly saw vitamin D deficiency, at just huge rates, almost 30 years ago. And so I began using vitamin D. It was one of the earliest things I began using for viral infections, flu-like illnesses, and I saw vitamin D turn people around from getting constantly, infected with these viruses and bacterial infections. And I've been using it for, like I said, over 28 years, and that's been a mainstay of our treatment. That's one of the mainstays of our treatment. It was vitamin A, C, D, and iodine orally.
Yeah, great. And then I guess just one last question because we're almost out of time. So someone asked, do you recommend a skin test with iodine to see how much is taken up? Would that be useful to judge if one is deficient?
That's an old wives' tale that you paint iodine on the skin and you time how long it takes for the brown iodine color to go away. And the quicker it goes away, the more the body is deficient that it absorbs it through the skin is the theory behind it. In practice, it doesn't pan out that way. When you paint iodine on the skin, about 80%, or actually it was over 80% in a study was found to sublimate into a gaseous phase and not be absorbed into the body. So the disappearance of the color might just be it's going into a gaseous phase and into the atmosphere. So that's not the best way to do it. The best way to check iodine levels is iodine status is a urinary iodine excretion test.
Yeah, okay, thanks. Well, we're mostly out of time now, so I want to go ahead and wrap up the questions. And thank you all for joining us. Thank you, Dr. Brownstein, for your time and for sharing your expertise and your experience. This is an issue that A&H is going to be continuing to cover and advocate on. As I said, please do subscribe to our newsletter and sign the petition, and we will follow up with a recording of the briefing. And we'll try to answer questions we weren't able to get to via email. So anything else, Dr. Brownstein?
Thank you for having me, and let's get something together and let's try and make the law appropriately applied and not misapplied like it's being done right now.
Yeah, absolutely. Thank you, everyone.